My name is Leah Lamatina. I am the coordinator of the Marshall Family Resource Center with Eureka City Schools. I'm also the chair of the Humboldt Network of Family Resource Centers. And welcome to session 3 of the Service Provider Roundtable. I'm super glad that we have all these participants and that you continue to come and join us each month for some really rich discussions on topics that are impacting our community. So this afternoon, we have a few presentations. We'll be following that up with a question and answer session, and then, of course, a survey. Also, if you've missed our first 2 sessions in the previous 2 months, we have recorded those sessions and they are located on the Humboldt Network of Family Resource Center website, hnfrc.org. So just some housekeeping, please add your name and who you're with, who you represent to the chat so we know who's here. And as a reminder, again, this session will be recorded and it will be shared on our website. So this afternoon, we're going to be talking about children's mental health and the impact of COVID-19. We have 3 leaders in this field from our community presenting with us today. We have Beth Hevlin, who is a children and family mental health and inclusion specialist with First 5 Humboldt and the Humboldt County Office of Ed. She's also the co-coordinator of the 0 to 8 mental health collaboration. We also have Dr. Constance Mitchell. She's a primary care pediatric nurse practitioner with Redwood Pediatrics. And we have Dr. Peter Stoll joining us, a school psychologist and coordinator of prevention and intervention services with the Humboldt County Office of Education. And before I turn it over to Dr. Mitchell, I'd like to give a quick shout out to our sponsors, the North Coast Clinics Network, Humboldt County Department of Health and Human Services, and Child Welfare Services, and the Network of Family Resource Centers. Okay, so I'm going to stop sharing and pass it over to you, Constance.
Thank you. Let me share my screen with the group really quick here. Okay, I hope everyone can see that. Thank you again, everyone, for being here. I know you're all very busy and your commitment to the children and families in our community has not went unnoticed. As Leah had mentioned, I'm a pediatric provider in our community. I have also worked with children in Humboldt County for almost 15 years now as a nurse previously. Excuse me. So anecdotally, in the clinical setting, addressing mental health has probably taken the most of my attention in my practice. And we know that COVID has affected us all in so many ways. Beyond just the fear of getting sick, children and adolescents' social, emotional, and mental well-being have also been impacted. And so today I'm going to share what research we do have regarding the impact of COVID-19 to children's mental health, some signs for distress of children, and how adults and care providers can support children's mental well-being during this time. So one of the first pieces of research I saw was in regards to ED visits. So the CDC did a study that was showing that from March to October of last year, we had an increase of 24% nationally for children between the ages 5 to 11 years old seeking mental health services in emergency departments. That same rate for children or adolescents 12 to 17 was 31%. Looking at the next study I was able to look at was in regards to the impact of lockdown and social isolation, and we're understanding that extent is directly related to the other vulnerability factors that a child and family are experiencing, such as development age, educational status, what pre-existing mental health conditions exist, being economically underprivileged, or being quarantined due to infection or fear of infection. Another interesting data point that came out to think of is that while we're all socially isolating, this is something that we're collectively experiencing. So right now we know that 91% of the world's student population has experienced school closures to some extent. So we know that stay-at-home orders are associated with an uncertainty and an anxiety due to disruptions in education, physical activities, and opportunities for socialization. We're seeing children impacted effects due to restrictions on their outdoor play and due to a lack of in-person engagement. Children who were struggling before the pandemic are even at a higher risk now. Prior to the pandemic, roughly 13% of adolescents received some sort of mental health services in the school setting. And of those 13% receiving services, 57 received all services at the schools. So now I want to ask the group to consider what this looks like for our community and how that's impacting our children and families. In looking at the economy and how the economy can impact families' mental health, in a study of the last recession, a 5% increase of the unemployment rate correlated directly with a 35 to 50% increase in clinically meaningful childhood mental health problems. So currently the unemployment rate is 11% compared to what it was at 3.6% prior to the pandemic. When the economy is in a bad place, we know that there's that direct impact to children's mental health. And what does that look like for our community? Okay. So looking at signs of distress for children and adolescents, stress can show up differently for children depending upon their ages. For infants, you might see differences in sleep and eating patterns. Toddlers, you may see a regression of development skills that was previously achieved. And studies are showing that we're seeing more clinginess, disrupted sleep, nightmares, poor appetite, inattentiveness, and significant separation problems. For school-age children, this can be seen in changes in their behavior, more irritable or the bouncing off the walls, impulse control difficulties, or new problem concerning behaviors. Signs of distress in the adolescent include changes in their activity level, excessive worry or sadness, unhealthy eating or sleeping habits, and difficulty with attention and concentration. They may show stress through increased anxiety and fear. School and activity closures for extended period of times for youth exposed to these debilitating effects on all levels as they're experiencing an increase in loneliness, anxiety, and uncertainty. We're seeing that there is a direct correlation with compulsive use of internet, social media, and that also increases our risk for mental health concerns. Any exacerbation in the symptoms and behavioral problems with youth who already have existing mental health conditions can be really challenging. So what do we do with this, right? As a primary care provider, it won't let me. I'm having a little technical difficulty. I apologize. There we go. I wanted to talk about our networks of care, right? We in Humboldt County doing this work before the pandemic know how dependent we are on all of each other. And so your primary healthcare provider is a resource for addressing children's mental health. We know that 94% of the children in our county have health insurance, right? So they do have access to primary healthcare services. And it's a misnomer to think of the medical home as just a place to just address physical ailments. We approach health from a holistic perspective, and that our physical health is dependent upon our mental well-being. The pediatric provider promotes mental well-being and supports the development of resilience. And we can recognize signs of mental health problems and assist in the coordination of mental health care. The healthcare providers in the position to recognize the physical manifestations of stress and emotional health problems in children, such as internalizing and externalizing factors or conditions. Checkups, again, those are more than just our physical, right? We can screen for various mental health concerns. So I had mentioned a network of care. What does that look like for our community? That is still in development, and we're all here as a part of that informal network of care. and that the pediatric providers should be working in partnership with mental health providers, service providers, school professionals, parents, and community partners. And we can do this work for the individual families we're serving while simultaneously creating an inclusive approach on how we make it operate for every child. And I know that's a goal of many of ours. So looking at what we can do, one of the resources I'll be sharing with the group, and many of you have already probably seen this, but this was our California Surgeon General playbook that was released for managing stress during the pandemic. And we have our main domains of wellness, right? And so I'm running low on time, but please do look at that resource. And I'm going to end just on the importance of relationships, that relationships can provide stability and support. Maintaining routine is significant. Talking, listening, encouraging expression, give age appropriate, honest, and accurate information, and the simple steps to being healthy. Be alert for any changes in behavior and reassure children about their safety and security. Also, so much of resilience comes from how we tell the stories about the things that we go through, helping children and young people express themselves and their many different feelings and thoughts on their mind will help them build a strength-based narrative. So to end, I just wanted to share, one resource that I've used in my career, and it's a book of children's drawings after 9/11. And I highly recommend it for anyone to look at. And then to consider, what is that going to look like, and what would those drawings look like for our children once we can say that this pandemic has passed. Thank you, everybody, for your time.
Wow, thank you so much, Dr. Mitchell. That was really helpful for setting us up for why this topic is so critical, and all those great resources, and just the role that pediatric primary care can have in the networks of care. We ask that you hold all questions for Dr. Mitchell to the end. We'll be taking questions for all of our presenters at the end. Now I'm going to turn it over to Beth. Ms. Heavlin, take us away.
I need to unmute myself. Good afternoon, everyone. It's so lovely to be here with you. I saw so many familiar names popping in as I saw people enter the room. And Constance, thank you so much for that rich information about the data and statistics and the importance of talking to children and creating a narrative. And I wanted to kind of partner into that, because I think that one of the things that we're all experiencing is that we are in this pandemic with the people that we serve. And we're experiencing the stress and the day-to-day changes as the families and other practitioners that we work with are experiencing them at the same time. And so really thinking about, what is your story? So today I want to talk about your well-being, because in order for us to make it through this, we need our providers to be healthy and well as we move through this pandemic and into what is next for us as a community and as a culture, and what's going to be the same and what's going to be different through this pandemic. So really thinking about, what is your story, creating that narrative for yourself. I think society is going to create that narrative for us about how many people have passed, how much our mental health has been impacted, what kind of economic challenges there's been. But then what is your story? What have you experienced through this? And what are the gems that you found? And some of the gems that I want to carry with me as I'm thinking about my story, there's the pieces, and I don't want to dismiss the stress and the anxiety that we all have around our family getting sick and our friends and colleagues getting ill, or losing employment, or worry about the children and families that we serve and how their well-being is. But what are the gems as well? And so some of the gems that I think about is, I know my neighbors. Before this, I didn't know my neighbors. I went to work really early in the morning and came home late at night, and my neighbors have come together and made a Facebook group, and we shop for each other and we take care of each other in a way that wasn't present before this pandemic. And I hope that becomes integrated into the story that I tell as my children grow and my grandchildren come and say, you lived through that pandemic. What was that like? I hope that I can remember some of these gems that come up for me. I want you all to remember that professionals who support others must consider it essential to understand your own stress response system and know how to regulate yourself so that you can relate to others. And when there's a rupture in a relationship, that you know how to make repair, because there are going to be ruptures in relationships. We all have a different additional stress layers on right now, and we're going to make mistakes in the relationships that matter most to us, those families that we serve, the children that we take care of, our colleagues, our own family members, but really working on how we repair when a relationship gets ruptured. This is going to maintain these healthy relationships through the pandemic and get us to the other side with that support network that we need to have moving forward. I think this is really important to consider as we move into having children going back to childcare centers, back to programs. We can't, I don't know about you who serve young children and families, but it's been really hard to access families. Parents don't want to sit on Zoom. It's overwhelming to them. And it's been really hard to make that happen. But what I know that I need to do is I need to find ways that I can regulate myself so that I can be a co-regulator when they're ready for my services. I want my teachers that are going back into the classroom to know how to regulate themselves so that they can be co-regulators to those children that have come back to the classroom. This is an essential piece of what is going to come next in our communities as we are going to experience a huge amount of stress in a new transition. I really want to encourage us to think deeply about how we do this, how we become co-regulators for those around us. I'm looking at this caregiver and child in the picture, and I just want you to notice the shared affect that they're having, the joy on their faces, and how that might look different with a stressed out caregiver. What might the interaction be here if that caregiver was having a different experience in this moment? If that caregiver was stressed and thinking about something else and off in his own world, would the same connection be happening that's so vital to what makes this photo so beautiful? If this caregiver was angry, what might that child's affect look like in that moment? So how important that co-regulation that's happening in that picture is to the beautiful affect that they're sharing. And this is what I'm hoping for as our teachers enter classrooms, as our caregivers bring back children into their programs, that they have the regulation in place, that they can provide this kind of affect to help write that narrative of what that transition is going to be like for that child to go back into that social setting. So I really want to encourage us to cultivate a community of collective care. And I found this quote that says, practicing mutual aid is the surest means of giving each other and to all the greatest safety and best guarantee of existence. So really thinking about how we provide others empathy, how we look at others with generosity, and how we make sure that everyone that we are exposed to and that we support leave our presence with a sense of dignity. Some of the things that are happening currently that I'm involved with, I just wanted to give you this slide to give you an update. I am the co-coordinator of the 0 to 8 Mental Health Collaborative. We have leadership team that people are welcome to join and participate in to help really build a system of support around mental health for young children and their families. Monthly newsletters, please email me if you'd like to be a part of that newsletter. I'm happy to add you to our network. We do a lot of reflective practice and mentoring. First Five has distributions and outdoor walking groups and virtual parent education that's happening. I gave you links to that First Five website so you can explore more what we're up to. And then the last thing I wanted to just mention to you that we're building a mental health pathway for high school students to learn more about early childhood mental health. And we would really love your participation. So there's a little survey here. If you're interested in helping us form this mental health pathway, please go to this survey. I'll put it in the chat box as my colleague Peter is talking as well. And I really encourage you to think about how you go out and regulate yourself today so that you can co-regulate others and become a part of that community of care. Thanks for your time. Lovely to see all of you. And now I'm going to hand it off to Peter, who's going to tell you more about what's happening at the Office of Education.
Okay, before I share my screen, I know I have limited time, and this is just like really pushing me to do something that's out of my wheelhouse, and that's be concise. So anyway, if everyone just like roll their neck for a second, just like, you know, if you're into it, take a deep breath in the middle of this day. I'm on Zoom for 7 hours today, but you're the largest crew, so you can bring it down. It's nice to see everybody. Thank you, Constance. Thank you, Beth. It's such important work, and thank all of you for being here, for being, you know, I heard something interesting today. Empathy is being able to be with somebody. Compassion is being able to remain with somebody in that hardness or that pain. So, and I know that I'm in a room with compassionate people right now. Earlier in my career, I would have freaked out about 117 people in the room. Today, I just feel good about it. So that's a nice developmental change. So here, let me bring this up. And let's get down to here. All right, we'll just start with this. Okay. We're happy when we belong. I like this. I saw this today. I heard this today. You know, I also heard something else today that I really liked. And somebody said, I'm a revolutionary in an incrementalist world. I think sometimes we want change to happen quickly, and it's incremental. And that's true in the schools. What I've really seen in 15 years in the Humboldt County school system and working with teams as a psychologist and behavior specialist doing individualized interventions and then moving more into systems work is I've seen a growing expanse of understanding of the importance of connection. You know, Beth is one of the people in Humboldt County that's like was on the ground floor of bringing trauma to our community and really explaining what that meant for brain development. And what we've learned, and our biggest takeaway about that, is that relationships are where it's at. Relationships are what matter most, that we need to feel connected. There's an idea, which I really like, around resilient children. And that idea is that a deep connection, a loving relationship with one adult can save somebody's life, can put them on a path of feeling that they belong and feeling that they're able. So at this time of COVID, right, I want you to think about well-being. Now, this is general. This is some recent work by Richard Davidson. I guess he goes by Richie. I don't know him personally. But these failures of well-being, right? Distraction, negative self-talk, lack of sense of purpose and meaning, and loneliness, right? So when we're building mentally healthy school environments, we need to be looking at ways to, you know, not make these things go away, but to pay attention to them and to respond to them in a quick and efficient way that, you know, that precludes identifying somebody is having, right, a mental health issue, a disability, right? We don't wait till then to do these things anymore. So a little bit there. We're talking about the pandemic. I've heard some people say that children are presenting with mental health issues at a rate of 35 to 40% more than they were prior to the pandemic. And we're mental health specialists. We know, right, that about 20% of a population at some point is going to need, or more, depending on where that is, but is going to need some type of mental health intervention in their life, right? We need to bring mental health out of the closet, you know, drop the stigma, and know that it is important to go to the brain gym. It's important to go to the heart gym. It's important to connect these things and do that work. So, but I do want to share this. This is pretty interesting. And I thought it was really interesting how this went with age, right? Some of us are probably thinking if there was another thing that said 14 to 18, would it be higher? Would it be more than 50? I mean, there seems to be a trend to me that is increasing as people get younger during the stress and anxiety that's happening during the pandemic. And I thought this was relevant to all of us. So I wanted to take a peek at this. This is some recent research between essential and non-essential workers, right? We know that we're essential, like what's essential, what's not essential. We could talk about that for a very long time. But what we do know, right, is that we're qualified as essential workers, many of us in the room, which means that, is it because we're empaths? Is it because we're on the front lines? I mean, why are we experiencing more mental distress? We are, right? You've all heard this, I'm sure. And if you haven't, I'm going to say it for the 100th time that I've said it at least. And that is, right, when we're on an airplane, what do they say? We got to put on our oxygen mask on before we help the kids. Recent research in social emotional learning has shown that adult SEL is the first step towards being able to help kids. When we look at school-wide interventions, the only behavior we can change is our own. Some of you know what PBIS is, positive behavior intervention and supports, right? A systematic framework to encourage pro-social, pro-academic types of behavior. And we know that that is essentially a giant behavior plan for adults. We need to change the way that we do business, because when we interact with a child and they're successful, they feel good, they feel a sense of belonging. We recognize that. That's our behavior. And then when we see them change their behavior, it gives us the opportunity to reinforce and embrace that. So I know I don't have a lot of time, kind of going all over the place, but stay with me. MTSS, this is the only thing I'm going to read to you today, okay? But MTSS empowers districts with a framework that engages schools, families, communities in an evidence-based, integrated, multi-tiered system of support, guaranteeing all students access to equitable, inclusive education focused on the whole child, increasing their behavioral, academic, physical, and social emotional strengths. You're all going to be able to, you'll receive this. And yes, this is a giant run-on sentence, but it's one of my favorite big run-on sentences, because what it really does is it takes into account not only the academic and the standards, but it also takes into account all children. It takes into account inclusive environments, inclusive educational environments, and the social emotional wellness and well-being of kids, right? And what we know is with learning loss, we're going to see regression in abilities to maintain, to know how to function well in a social environment, right? And that's no one's fault. That's the situation we're in. But educators are going to, we need to receive, and all of us need to receive this in a way that's empathic, right? Supportive and skill-based. There's some students that are really going to struggle with wearing a mask. And they already are. There's some students that are really going to struggle about hand washing, right? I know kids that social distancing, really not even in their repertoire. So, it is really going to be us modeling what these behaviors look like and reinforcing that. When I talk about MTSS, which is again, multi-tiered system of support, when we think about that in mental health, what does that do? It includes prevention and intervention services that improve behavior, right? It improves access to needed mental health services and resources. It improves engagement and collaboration among each other. And boy, I tell you, that's the silver lining of this pandemic. I've been able to sit with groups of educators and have meetings across the state, go into breakout rooms and have what feels to be very authentic, intimate interactions with each other. And what we're doing is we're creating a new paradigm, which is breaking down the barriers, working with each other, braiding our funding, and figuring out how to get kids services as quickly and efficiently as we can, right? That's what we're doing with the Humboldt Bridges to Success. That's the goal of the Family Resource Centers. That's the work that we've been doing with our Native entities in our community and remaining culturally sustaining. Ultimately, what do we want to do? We want to improve student outcomes, academic, behavior, and social emotional, right? Across those domains. And you know what? They're all intersect. If you think of a Venn diagram, you put all those things together, the child's right in the center of it all. So as we do this, always an eye towards equity, right? Responsive to trauma, meeting the diverse need of all of our students, right? Respectful, I like that, respectful of social emotional learning needs, right? As a behaviorist, I think two things when I see problem behavior, right? It's a form of communication and it's a lack of a skill or both. So how is it that we listen and receive what that communication is without judging the child, without putting this kid has got an emotional disturbance, so they're going to be this way. It's no. What's the skill that needs to be taught, right? So we want to address race, language, gender, ability, SES, all those things, right? And being culturally responsive. The term that I really like to use now is culturally sustaining. Let's move forward beyond just responding to what that is, and let's hold it up and sustain what it is for what it is, okay? So, little tiny bit here. This is, I would encourage you to go to castle.org. Easy to remember, great websites, collaborative of academic, social, emotional learning, right? What's wonderful right now is sometimes I used to hear when I first came to Humboldt County, right? Oh yeah, we do social emotional learning. Yeah, we do that for, I think it's 20 minutes on Thursday mornings. It's like, no, right? It's good to have social emotional curriculum. It's important to have tools that help us move this forward. But these are things that need to happen all the time. Right? So when we're looking at education, when we're looking at students, we're looking at self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. That is SEL, and that should be happening in all environments all the time. And that's true in the work that we're doing in the community as well. This is not mutually just about the schools. This is the school context, right? But the classrooms surround that, schools surround that, home and communities surround that. I'd love to get into that further, but I know I'm getting to the end here. I want to show you this because, you know, any of you have ever heard the MTSS jokes, if I don't show you a triangle, right, I'll get cited by the MTSS police or the PBIS patrol. But this is essentially it. And this is what I want you to think about, and I'm going to leave you with this, right? When we think about MTSS, whether it's academic, social, emotional, or behavioral, what we're looking at is providing a dose to everybody, right? So the green is really underneath all those colors. The green is the entire triangle. That's all the students. What is everybody getting for social emotional? What is everybody getting for enriched academic instruction? What is everybody getting around behavioral education? And the thing is we use screeners early on to identify students that need a little bit more, because when that child needs a little bit more, it's a little hard to see in the yellow, but now we do low-level targeted interventions for those kids. And this is where the bottom falls out a little bit sometimes for schools. And it's where I look to everybody in this room to assist, because preventative, easy, right? This is harm reversal. This is taking a situation, recognizing it early and moving back into the green. It's a low-level, oftentimes group intervention that's targeted for that type of student, right? Now, what happens if we have a good universal intervention and then we have a strong tier 2, which is that secondary level, that little extra that we need? We're going to reduce our need for tier 3. We're all good at tier 3. I showed up in Humboldt County, we were at 80% tier 3. We're real good at intensive individualized. We're real good at that. I mean, we could use more of it. We can always use more of it. I'm not saying that we have enough of any of this, but I am saying that we have twice the special education rate in Humboldt County as we do in the rest of California, right? And we know that mental health issues correlate with, right, somebody who finds themselves in a special education situation. Not all, but some, right? We also know that we have a high need for, mental health. intervention, intensive individualized intervention, which is our tier 3, right? Special education, individual therapy, those types of things. Probation, all of those, very intensive, individualized, lots of resource, lots of time, right? And then when you get to that point, for a lot of those people, it's about harm reduction. It's not about reversal as much because you've gone to that extreme place. So the message I think we all leave and we all embrace is prevention is the most important. What we need to be doing right now we talked about that elevated number, and I'm going to wrap up with this, but that elevated number of students that have mental health issues, if we know that it's increased, if it really has increased maybe 35 to 40%, it was 20 before, we're looking at a large number of us that are experiencing anxiety and mental health. And so who needs to do the work? We can't just hire a bunch more individualized clinicians and go serve everybody. We have to build it in everything that we're doing. So it becomes preventative, it becomes a community-based effort, it becomes reaching across our, our barriers, our silos, whatever we call it, and creating opportunities like we have today to share information and to tighten the rich net that we already have in Humboldt County to serve more students. So I leave you with that. I'm going to do a little shameless plug, because when Taffy called me and told me about this crew, it was interesting because we've been putting forth an effort, because I've been working with the UROC Behavioral Health Task Force, realizing all the services they had and just thinking, my gosh, I've been in this field for a long time. I didn't even know about some of these things. And I also coordinate crisis response when bad things happen, people call me. And so, and I do know through the social capital and the connection that we have with each other, once we understand each other, we understand what we're doing, we build the relationships, then we're going to be more effective in the service delivery. So how do we tighten the net? We do it by creating social capital in the form of relationships and understanding of what each other does. So quarterly, we're doing this North Coast Service Providers Consortium, which is a deeper dive, like 2.5 hour experience, just 4 times a year, where we're really bringing service providers like yourself together. I mean, I can get together all day long with admin and have conversations, but what we really want is for each other to have the opportunity, get face to face, get into breakout rooms, talk about some things and see what it is that we can do to improve. So I'm honored to be here. Thank you. Thank you all for the work you're doing, and stay safe. So, and thank you.
Great. Wow. That was pretty awesome. Thank you, Dr. Constance Mitchell, Dr. Peter Stoll, and Beth Heblin for the presentations this afternoon, and really for all of the work that you're doing in this community to support parents, children, young people, and of course, all of us service providers. It's really incredible. And thank all of you, all 116 participants who's joined us. If you would like to do a deeper dive into these types of topics and being more connected with each other, I believe in the chat there's information about Dr. Stoll's quarterly group, and we will be emailing that information out as well to all of the participants I've attended.
Yeah, I just want to say, Leah, and thank you. And sorry, I just want to say that the prevention and intervention team's in the house today. So Marcy Zapagno and Julia Leonard. So they're the ones who are dropping things in the chat. So the invite's there. Please join us, pass it along. And thank you for calling it my group, but it's our group. So anyway, I encourage you to come.
Sure. Yes, you have a wonderful team. I did not mean to take any part from them. Your team is amazing. I have been to your team's group, and it was great. So I urge others to join that as well. Also, in the chat, Beth Heblin left information about the survey for the mental health workforce pathways. That too will be emailed. I urge you to fill out that survey and allow HCOE to mine some information from this great group. We are going to move into question and answer period. And so we have about 10 to 15 minutes for questions and answers. from all of our panelists. So feel free to ask for any of our panelists. And if you could just type your name into the chat box, and I will be able to call on you to address the presenters. So we have a bunch of thank yous. Great information, inspiring. So I'm leaving the chat box open. If anybody has any questions about the great material or any other, these presenters are involved in so much in our community. So if you have questions about getting connected, I will leave their information, their contact information at the end.
So one of the questions I saw earlier, Leah, was whether or not we were going to be emailing out these presentations along with the rest of the information. As long as the presenters are okay with that, that's definitely something we can make happen.
Sure, I'm seeing Beth is shaking her head, thumbs up for Peter and Constance. I'm sure is fine with that, although I can't see her throughout the many I have in my participants. And Constance also left some really great resources in the chat. We'll make sure that we get that out to everyone as well.
Hey, Leah, could you, there's just a white box on the screen right now, just so you know. I didn't know if you could turn it so we could all see each other at the end.
Sure, I can. I'm not, Peter, am I not sharing screen?
You are sharing screen, but it was just blank and white.
Oh, okay. So
and now it's your desktop.
Oh, I'm having issues with technical challenges, which is pretty much par for the course for me, but am I not sharing resources?
No.
Okay, thank you. Try again. Huh. There we go. Got it. Now, how's that, Peter?
You can see it when you do that, but when you put it into present mode, it seems to vanish. I don't know if I'm the only one that's seeing that, but that seems to be what happens. You put it into a bigger mode and it just becomes a white screen.
Great. So they're going to stop sharing and then we can all look at each other. So thank you for that. And thank you to everyone else who's giving thanks on the chat. So we have a list of resources that I'm struggling with sharing the screen. So we will make sure that gets emailed out to all of the participants. It's some really great resources, which Taffy is not having technical difficulties. Thank you, Ms. Stockton. So there's some really great resources that were shared prior to the presentation from our presenters. So some local ones and then some national resources as well. Again, it'll be mailed out. And then next slide, Taff, if you wouldn't mind. So we're gonna do a survey at the end of each of our roundtables for those who have been visited with us the last 2 months. We ask for your help to do an evaluative survey. So please take a moment. That will be posted into the chat by Trisha. So thank you, Trisha, for doing that.
And then Leah, there was one question.
Sure.
What kind of help Beth, what kind of help are you looking for in creating a workforce pathway for mental health for high school students? And then I can launch the poll.
Great, thank you.
I'll answer, and Peter, please feel free to join in. We are looking at creating a mental health pathway for high school students, and we really would love your input about what's needed in the community. So the survey we sent out just has 2 questions. Are you interested in what's your email address? And what we'd like to bring this group together to do is really bring you together with a survey and then maybe some focus groups to hear more about what you're thinking we need to have in the community as we move forward with this project. Peter, do you have anything else to add?
No, I mean, that's really it. It's this wonderful partnership, and you know, we're aware that we need an increase of workforce for mental health in Humboldt County, and to provide an opportunity for high school age youth to orient themselves, the importance of child development, the importance of an awareness of trauma, and then, you know, an idea of what types of opportunities exist in the mental health field. So you'll see on the survey did we drop that into the chat already, Beth?
I did, yes.
Yeah, we might want to do it one more time if you got the link handy, in case anyone missed it. But please take time to do that, and also know that if you put your email on that, I'll put you on the list for the North Coast Service Provider Consortium as well, if you'd like to have the opportunity to be notified when that's happening. So yeah.
Thank you, Beth and Peter. Also in the chat, Allison Tans had a great thank you, so I'm going to read it. She said, "This was a great presentation. So happy to connect here with so many of my favorite people." Oh, now I lost it. My favorite people and colleagues through the years. May we all continue to be revolutionaries in this incremental work. And I really enjoyed that quote as well, Peter. But also from Allison Tan, she said that she would love to get involved with those pathways and has some information from around the state. And then
That's great.
Karen,
We'll definitely get in touch with her.
great. And then Karen Deere says the link is not working, might be a firewall. So Karen, we can reach out to you to make sure that you have an accessible link. We'll get that to you. Beth, thank you for sharing that again. And I really urge people to get involved and fill out that survey. Great.
And Leah, you've got someone raising their hand.
Sure. Please.
Can I ask a question real quick?
Yes, absolutely.
So I think this is for Peter or whoever else. So you mentioned your interaction with other folks from the state. So I'm wondering, out of curiosity, is there up on this subject matter, is there something unique about like rural communities in Humboldt County that's like a little different than urban communities? Like, are we less or more impacted? Are we impacted in different ways because, you know, we're like maybe closer or further away, or is there anything unique that you can illuminate?
Yeah, Nate. Well, just, you know, a few things. It's interesting because a big push at the state level right now is for social emotional learning, and to really embrace adult SEL as well as child SEL, and pushing that out into the community. And to see that is incredibly heartening, especially during this time. I mean, I think it's one of our silver linings, and it was happening before COVID. We were moving in that direction, but I think it really has brought it to bear. We are part of what we call community of practice. So we get together with the community of practice is kind of interesting if you think of like the Russian dolls that all fit inside of each other, right? We have our Humboldt community of practice, and then we've got a NorCal rural community of practice, because exactly like you said, the issues are unique. And then we have this statewide community of practice, which is really technical assistance, providing opportunities for resource and to make connections with each other. But what we do know, right, and part of this technical pathways around mental health speaks to that, but we know that we have of the state's highest adverse childhood experiences in Humboldt County. We know that it's really challenging to keep psychiatric care providers in the county, especially MDs, as well as general practitioners, and then the list kind of goes on. And we know that there is, you know, there are issues here. We live in an urban area. I mean, we live in a rural area with urban issues. right? And so we've seen that as well. So it is unique to rural. We share a lot with all of our communities, but our rural communities need to communicate well with each other around these issues of resource and delivery.
Great, great. Thank you, Peter, and thank you, Nate, for that question. So
Nate,
now,
I would, if you don't mind, I'm just going to add that
go ahead, Dr. Mitchell.
one of the things that, as we're seeing an increased need for mental health interventions, is that we do have difficulty with access, and that existed for our community before the onset of the pandemic. And so we're only compounding that. Anecdotally, I think I have the biggest challenge in finding mental health support and services for families with private insurance.
I want to, and Constantine, Constance, you brought up something. Sorry, you brought up something that I just like to comment on, and that is that there's a real reason that we're seeing a movement to push mental health into the schools, because we know that that's where the kids are. And we need those community-based efforts happening as well. But the more that we can build some rich mental health in the schools, it's important. And I've done some work recently with Virgil Moorhead Jr. Over at Two Feathers Native American Family Services, and he said something that really struck me in some work that we were doing earlier. And he said, we need to look at school as medicine, and I like that idea. How is it that we are responding, right, to the presenting problems in a way that's holistic and meaningful? So I just want to say that I think that we're going to see more of that happening in the future.
And I wanted to just end with a really positive note that because of our rural nature in Humboldt County, we have learned to work together. And on this call, you've heard about a couple of collaboratives that you're welcome to join. And we work together to shift what's possible for our community. And I just love that about our rural community. And I hear from our neighbors in larger communities that it's just not the same elsewhere. It's really hard to gather resources and gather people together and work collaboratively. So I'm really excited to have those of you who sent me notes that want to join our collaborative, and have you join Peter's collaborative, because it's going to be all of us working together that's really going to make the ruralness of our community special and networked. So thanks so much for that question, Nate.
Great, and thank you, Beth, for mentioning that as well. That is a gem that I take away from this pandemic is the strengthening of the relationships built throughout the collective come together to meet the needs. So I believe there is a quick poll. I hope you can all see it. We would love to have feedback about this afternoon's service provider roundtable. It's really helpful to have it as an evaluative tool. And we'll take just about a moment if you can do
We're
that.
good with the poll, Leah. It
We
looked
are.
like most people had filled it out.
Awesome. Thank you. And so I'd like to take another moment just to thank our sponsors, the Humboldt Network of Family Resource Centers, the North Coast Clinic Networks, and Department of Health and Human Services, Child Welfare Services. There is a team that gets together from these groups that meet each very regularly throughout the year to provide and make sure that we are providing relevant information. So big thank you to the members of that team that are here today. Another thanks again to Beth Hebland, Dr. Peter Stoll, and Dr. Constance Mitchell. And I believe we're going to put your contact information up. So if any of you would like more information or to connect individually with any of the presenters, please feel free to utilize their email. Thanks so much for all you all do. And thanks all of you who joined us for spending your lunch hour with us.
Thank you, everyone.
Thank you.